Bismillahirrahmanirrahim. In this lecture, we will discuss Parkinson's disease, and it's the part of physical medicine and rehabilitation module. This is my disclosure. Pictures included in this lecture are not the property of myself and were obtained from Google Images search and referenced on the slide. The material is being used for education purpose only, and M. Khan does not claim ownership and rights to this material and will not be printed or copied in the handouts. This is the introduction. So in previous lectures, we have talked about community-based rehabilitation, and my other colleagues are talking about the rehabilitation in detail in various topics. We will cover the neurological disorders that are a significant cause of disability, and Parkinson's disease is one of them, and we will discuss Parkinson's in this lecture. These are the objectives. By the end of this lecture, students will be able to discuss Parkinson's disease, describe the pathophysiology of Parkinson's disease, and explain the rehabilitation process. That's the main part of the lecture. So what is Parkinson's disease? So it's a chronic progressive disease of the nervous system, and it's common in 50 to 60 years of age, and men and women are equally affected. If you think about the pathology, it's a basal ganglia disorder and accumulation of a protein into Lewy bodies, and its lack of inhibition of excitatory motor activity. So what does it mean that if there is any problem in basal ganglia, there is another part of the basal ganglia which is called substantia nigra, which releases the dopamine, and that dopamine is responsible for inhibiting the excitatory motor activity. So if the dopamine have any problem, or there is loss of dopamine, then there will be overactivity in the muscles that will cause rigidity and stiffness in the joints and rigidity in the muscles, and that will cause tightness around the whole body. Cardinal signs. Since there is no reliable clinical test for Parkinson's disease, and the diagnosis is made solely on these cardinal signs. The first one is bradykinesia, which is slowness of the movement. Then we get resting tremor, then rigidity in the joints and muscles, and we have postural instability. So the patient will be posturally unstable. They will have a tendency to fall, and they will be having difficulty in walking and turning around. Etiology is usually idiopathic, and that is the most common. So mostly there is no cause for it. Second, it could be secondary to virus, toxins, drugs, and metabolic causes, but that type is rare. Parkinson's disease patients could be actually put in two main groups. In group 1 patient, they will have rigidity, that is tight muscles and contractures in the joints, so there will be very stiff joints all over around the body. There will be bradykinesia, so which will be slowness of the movement, postural and gait problems. So these three signs will be more apparent. And also in group 2 patients, they will have resting tremor. So a lot of research will say that resting tremor is a sign for a differential diagnosis for Parkinson's disease, because rigidity, bradykinesia, and postural gait problems could happen in other neuro disorders, but resting tremor is a special sign for the diagnosis of Parkinson's disease. So what about the main impairments? If we think about the impairments and functional limitations in Parkinson's, so there will be gait disturbances, which will mean that patient will be unable to walk and they will have a tendency to fall. They will be having difficulty to initiate the movement. So if you ask them to lift their arm or lift their leg, they will be having problem to initiate the movement. There will be dyskinesia and dystonia uh, in the joints and muscles. There will be orthostatic hypotension, and it means that if the patient is sitting up from a lying position or standing up from a sitting position, they will have a tendency to drop their blood pressure, which is called orthostatic hypotension. They may have swallowing dysfunction, constipation, bladder problems, cognitions, and they will have pain as well. So they will have a lot of pain due to increased rigidity and tone in their muscles. Rehabilitation process again, that in the rehabilitation process, it will be interdisciplinary team approach, medical and nursing. So the medical team could prescribe them some medication, and they will need a nursing care. Physical therapist can work on their joint mobility, joint contracture, and improve their mobility, and give them some strengthening exercises. Occupational therapist can work with them functionally, just to help them getting dressed, washing, dressing, grooming, etc. Speech therapist can work on their speech if there are any problems. Clinical psychologist, because these patients will a lot of time having a lot of depression and anxiety, so a speech therapist will, a clinical psychologist will be required to look after them. And they will also need some orthotics advice, and the orthotics is actually providing an external support for the joint, because these patients will have a tendency for the joint to come into flexion, so they will be prone to more flexion contractures, or the movement will be lost. So we can keep the joints in a proper position, we can refer them to an orthotics. And a dietitian will be required if the patient has some nutrition issues. We can carry out some relaxation techniques to decrease the rigidity, because they will have rigidity and stiffness in their body. So we can carry out some techniques to relax their muscles. There is slow rhythmical rotational movements of the body segment. So we will be doing a lot of rotation exercises for these patients. Stretching exercises to prevent contractures in their joints. We will be doing a lot of neck and trunk rotation exercises on the mat or on the bed. And back extension is again a very important exercises for Parkinson's disease, because these patients will have a tendency to come into flexion. So that's why we encourage to do a lot of extension exercises, is to correct their posture. And proper sitting and posture control exercises, because these patients will have a tendency to fall on one side. So we will give them a proper sitting or a posture control exercises, so they shall be able to sit independently on a bed or on a chair. Aerobic conditioning and swimming and walking and cycling, these kind of exercises they can carry out. Functional mobility training, we can do gait training, walking exercises on the stairs, indoor and outdoor mobility. And family education is another very important component in all rehabilitation program, and a home exercise program, because the patient may not come to a clinic every so often. So they may be able to come only twice or thrice a week. So in that way, the family should take the responsibility. If we educate their family about the exercises and the patient management plan, so they can carry out the exercises in their homes. They can also be advised some stationary bicycle, because they can't go out to the gym and they have decreased mobility, so they can do the exercises at their home. Gait training, walking practice, mobility aids, we can give them some like a walking stick or a walking frame if they have balance problems, so at least they are mobile and keep doing the exercises. And a lot of breathing exercises just to keep their lungs healthy. These are the references. So is Delhi SARS Physical Medicine and Rehabilitation, is chapter 26 on page 645. So you are expected to have a read through that as well. Okay, thank you very much.